Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. Of course, website thisweekinamerica.us. As mentioned, Holly Bridges is our guest in the program today. She spent 15 years as a CBC radio and TV journalist, talk show personality across Canada, award-winning writer, 30 years experience in journalism and communication. She's a sought-after speaker and author of the book we'll be talking about, The Hysterectomy, Solving Your Painful, Heavy Bleeding Without Major Surgery. Holly, welcome to This Week in America. Great to have you with us on the program.
Thank you so much, Rick, and I really want to congratulate you for tackling this subject on your program. It shows a lot of courage and a lot of vision, so I thank you so very much.
Well, it impacts so many people, and I'm looking at a statistic on your website, and the website, by the way, is theonhysterectomy.com. We'll give you that during the course of the program. And you basically say there's an 80% chance that you might be one of the women out there who really doesn't need a hysterectomy.
That's right, and we should probably step back and just give you some of those numbers. I mean, every year in North America, 700,000 women, Rick, undergo hysterectomy. That's here in Canada, about 50,000, and in the United States, where you live, it's 650,000 women. And from my research and from interviewing some world-renowned gynecologists and reading studies and doing my research, because I am a professional journalist, I've discovered that anywhere from about 60 to 80% of all hysterectomies in North America and in some other countries are medically unnecessary, meaning that they could be avoided if a woman so chooses. They could be avoided through other state-of-the-art, high-tech alternatives. And I really want to emphasize the words "if a woman chooses," because you know, those 80% of hysterectomies, for the most part, are elective because the 20% are for cancer primarily. So really, at the end of the day, that 80% of women who are having hysterectomies usually undergo them at the advice of their gynecologist or themselves. They just march in to the doctor's office and say, "I am so done with these periods, take it out."
You know, what's interesting is you went through that period where you decided, okay, I'm really going to look into this. And because of the research that you did, and again, you're trained in this area, because of the research you did, it really spared you with this operation.
It did. And if you don't mind, I'd like to share a little bit about
Please.
my story, because a lot of women can relate to my story. It was about 5 years ago, Rick, when I was a single mother and I had 2 preteen daughters at home. And I started noticing that my flow was particularly heavy, and it just got worse and worse every month. And this is an important thing for women to listen to. I was changing my supplies about every 60 to 90 minutes. And I now know that that is not normal. Okay, ladies? So if you're listening, it is not normal to be changing your supplies every hour or 90 minutes. It got progressively worse to the point where I was anemic, I was exhausted, my mental functioning was basically in the toilet, literally. I couldn't remember things, I couldn't grasp onto anything that anyone was saying. So I went to my family doctor for what seemed like about 1,000,000 times, and finally I was referred to a gynecologist, and he said that basically I had what is known as fibroids. These are non-cancerous tumors that grow in about 1 in 4 women's uteruses, and they're benign, they're not cancer, but boy, do they cause havoc. They bleed every month, they erupt, and they cause the tremendous heavy bleeding. So cut a long story short, I was scheduled to have the hysterectomy because I just said, I cannot do this one more month. So I scheduled it, and unfortunately, about 3 weeks before my hysterectomy, my beautiful sister, who was only 52 at the time, she passed away in a car accident. And so, you know, I gave the eulogy at the funeral, and, you know, she left behind her 11-year-old son, and it really got me thinking, and I was bleeding through the eulogy, and it was just awful. So I said, you know what, there has to be a better way. So I put my journalistic skills to work, Rick, and I started treating this issue like it was a story that I had to write. And I found that I was not alone, that most women are recommended hysterectomy when they really don't need them. So cut another long story short, I searched for a doctor and found one, Dr. Soni Singh, who turned out to be the medical editor for the Hysterectomy. He volunteered his time. And he performed 2 of the most high-tech, state-of-the-art surgeries available in the world today. And I walked out of the hospital, Rick, without even taking an Advil.
That's just amazing. And by the way, the doctor wrote the foreword for the book. That's the nice thing. One of the nice things is you're reading the book. This is all backed by science, all backed by medical research. This is not some theory. This is actually medical people saying, yes, this really is the way this is. It can be, certainly. Holly Bridge is our guest on This Week in America. The book is The Unhysterectomy, Solving Your Painful Heavy Bleeding Without Major Surgery. Her website, by the way, is theunhysterectomy.com. If you would like to get a copy of the book, you can go there, and there's a space for a coupon code. If you put in Bratton, Bratton, capital B, you'll save $5 off the price of the book. Shipping and handling is always free. And you get a lot more information on the book as well, theunhysterectomy.com. When we're talking about that, and again, approaching it as a journalist, because this does read like you're doing a story, you talk about some of the myths, and these are the things that people are led to believe, and a couple in particular. Number one, that it's normal. And I think that's what you said you were basically going through. What you went through to you was probably what you thought was normal from what you were led to believe.
It's so true, Rick. And I think as women, we tend to do that. We're so busy. You know, we're juggling family, we're juggling work, we're juggling our homes, driving the kids. We're trying to get through the day the best we can. And so because we've been having periods since we were young girls, you know, we've tended to accommodate, and we've tended to normalize our symptoms. And so, you know, every month, if our periods get heavier and heavier and heavier, and those around us notice, I mean, our husbands, our children, our parents, our loved ones, they notice that something's up, but we just think that's our lot in life. So we suck it up, we go through the supplies. And I mean, one of the studies I quote in the book, Rick, I'm sure you might recall, that the Johns Hopkins Center for Public Service did a study that showed that the average American woman who suffers from heavy menstrual bleeding, which is the clinical term now, pays about $5,000 a year just in lost wages, lost days at work, and supplies. And yet these women are not, you know, they're not in hospital. They're not recovering from a medical issue. They're out there doing the things that I explained earlier. So they're thinking it's normal. And one of the main messages in my book, one of the main myths, as you mentioned, it's not normal. And that's backed up by every physician that I interviewed for this book. So what does that mean if it's not normal? It means that women have to get their tail down to their gynecologist's office and insist on testing and diagnosis.
Another myth, and then we'll get to some of the things that some of the alternatives that you list in the book as well, the book, The Hysterectomy. And that's part of getting older, because you hear some people say that's all part of getting older. This, again, it's normal in the aging process.
It can be a function of perimenopause, that period that women go through before their periods. I mean, estrogen can cause some of the fibroids like I had to grow. Estrogen is what makes fibroids grow. So as we hit perimenopause, sometimes our bodies can experience a surge in estrogen, so I'm told by the doctors I interviewed. And also there are those other experts out there who believe that some things called estrogen mimickers that are in our environment, the food we eat, the air we breathe, and that sort of thing, food packaging, can also contribute. I don't really discuss that too much in the first edition of the book. I touch on it a little bit in the second edition, but it can be a function of getting older. However, I must stress, Rick, that I have women in the book as young as 25 years old who were being told that they needed hysterectomies for endometriosis or fibroids or that sort of thing. And if it were not for their own tenacity and their own homework, they would have had those hysterectomies. One woman in particular named Shannon, there's a beautiful video of her on my website on hysterectomy.com. She was 7 months pregnant on her wedding day because she found Dr. Singh, my medical editor, on her own, and now she has 2 beautiful children.
You're listening to This Week in America. Holly Bridges is our guest on the program, author, patient advocate, author of the book, The Hysterectomy, Solving Your Painful Heavy Bleeding Without Major Surgery. That's the key, without major surgery. The website is unhysterectomy.com. I'll mention once again, if you go to the coupon code area, just put in my name, Bratton, Bratton, capital B. You'll save $5 on the cost of the book. As always, shipping and handling is free, but just put the Bratton in the coupon area and you'll save $5. I want to go back to why this happens, why this continues to happen. Is it because it's easy for the doctor? Is it because it's an expensive procedure that will be paid for by insurance? Why is it so overprescribed?
There are about 10 reasons why, Rick, and it would take me a long time to explain each of them, although I do go over them in the book. And
Yes.
that's really sort of the heavy hitting chapter, if you will, why so many hysterectomies. It's a complex issue, and I can tell you that the numbers of hysterectomies are going down, so clearly we are making some inroads, but it continues to be the default surgery for the treatment of heavy menstrual bleeding. Women have grown up seeing their mothers get hysterectomies, their grandmothers. I've got some doctors in the book who say there are some towns in the southern U.S. where you can't find a uterus because it's a societal and cultural expectation that when women bleed this heavily and they've finished having their children, take it out. On the medical side of the house, I also have doctors in the book admitting that they were not trained to do anything else except hysterectomies. And so things in medicine are very slow to change. So you have gynecologists now who are at the peak of their careers, or maybe a little bit past the peak of their careers. But when they went to medical school 20 and 30 years ago, the idea of these high-tech procedures that can be done in 90 seconds, they hadn't even been invented yet. So doctors are all about results, right? They want to know that they can help and cure their patients, and I respect that. The problem is that technology is moving faster than they are. Technology is outpacing doctors' abilities to retrain and upgrade their training. In the majority of cases, I shouldn't paint a broad stroke because there are some trailblazing gynecologists out there and endocrinologists who are doing marvelous work. Thank God they are, because, you know, I would have had a hysterectomy otherwise.
I want to talk about alternatives, but I don't want to let that go because you're talking about there are good doctors out there. The question, if somebody's listening thinking, yes, I would like to talk to one of these enlightened doctors so I get an objective medical viewpoint on where I stand. How do you go about finding a doctor like that? And what are some of the questions you should ask your doctor to find out if he really fits into this category?
Women can do their homework. Obviously, I think the first thing women do nowadays is they tend to go on the internet and they start researching. I would strongly recommend that they do read my book. And I know that sounds like a sales pitch, but really I've done all the work for them. I've done the research for them because I am a professional journalist. But the first thing they should do is they should go to their primary caregiver, their family physician, or whomever they see on a regular basis. I know in the United States, a lot of women see their gynecologists as a matter of course. In Canada, it's a little bit different. The idea is you should have your first conversation with your primary caregiver, and you should describe your symptoms, describe your case history, how long it's been going on, and you should insist on having the most recent diagnostics, such as an MRI or a pelvic or vaginal ultrasound, blood work to see how anemic you are. And if that physician comes back and only recommends one course of action and you're not comfortable with that, you either say, okay, thanks very much, doc, bye-bye, I'm going to find someone else. Or with the information you read in my book, you can open the book to page 193 and say, I'll have what she's having. I want this procedure. Am I a good candidate? So if that first dialogue doesn't work, then I have a chapter in the book, How to Fire Your Doctor. If you're not happy, then you can move on. I will also recommend that women check out a website called www.aagl.org. And that stands for the American Association of Gynecological Laparoscopists. It's a mouthful, but there's a physician finder tool on there, Rick, with a drop-down menu, so women can enter their city and their state, and they can actually find a list of gynecologists in their area who perform minimally invasive gynecology.
Time is going by way too quickly. Just a couple minutes left in the program, and I will say in looking at the book, it is very thorough. It walks you all the way through this. The questions that Holly says you should ask, the procedures you should consider are all listed in the book. The website is on hysterectomy.com. Promo code area, if you put in the name Bratton, B-R-A-T-T-O-N, capital B, you'll get $5 off the book. Shipping and handling is free, as is the case. And the website has a lot of excellent information there on hysterectomy.com. Let's close by talking about a couple of the alternatives. One you talk about is a procedure that takes like 90 seconds.
That's right. It's called an endometrial ablation, and those ablations have been around for years, but they have now moved into the second generation of these ablations. And I had one called a hysteroscopic endometrial ablation, and what that means is the doctor, I was in the OR, and I'm telling you, Rick, it looked like a video game arcade. It had big screen TVs. The doctor had these laparoscopes or hysteroscopes that were about this long. His hands didn't even touch my private parts. It was all done with scopes. So you've got the hysteroscopic endometrial ablation, where the lining of a woman's uterus is basically destroyed, and so she doesn't get the monthly buildup. You can also have what's called a hysteroscopic myomectomy. That's for fibroids. That's what I had. Again, they go in with these scopes and they just cut out the troublesome fibroids. There is a risk that the fibroids can grow back, but that's a risk that women have to be willing to take. You can also have focused ultrasound. That's completely touchless, scarless. The doctor just used focused ultrasound. There's uterine artery embolization, much too complicated to go into here, but it is covered in the book. There's hormone therapy. Doctors are finding amazing results with even the birth control pill or the Mirena IUD, which is what I had. It's a hormone-releasing intrauterine device that releases hormones for up to 5 years. I'm telling you, Rick, I had that until I had my surgery, and it stopped my bleeding cold. And I could have kept it in for 5 years if I wanted to. So there is a full range of things that women can have that they're just not being told about. So I would say just a couple of questions women should ask their doctor. What's your philosophy of care? Do you go along with minimally invasive gynecology? And if so, how can you solve my bleeding without removing my uterus? And how experienced are you at doing those things? And if not, time to move on.
The important thing is alternatives, so you understand that there are alternatives to the hysterectomy. A number of chapters in the book devoted and going into detail with what Holly was talking about, the procedures that are available. Unfortunately, out of time, with us on the program, Holly Bridges. The book is The Unhysterectomy, Solving Your Painful Heavy Bleeding Without Major Surgery. Her website is unhysterectomy.com. Again, if you go there and you're interested in the book, you just put in Bratton, capital Bratton, in the coupon code. You'll save $5. Shipping and handling is free. A lot of good information there as well. Holly, thank you so much. It's a great service what you're doing. Look forward to having you back on the program, and thank you for joining us.
Thank you, Rick. And again, thanks for your vision and for your interest in the subject. Thank you. It's been my pleasure.
Well, it's been our pleasure to have you on the program. And of course, all the information is available at our website, thisweekinamerica.us. You can go there or log directly onto Holly's website and get all the information. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.